and welcome everybody to the Healthcare Workers Council Vaccine Town Hall, hosted in collaboration with the Tony Mazzocchi Center. My name is Tamara Lefkowitz, and I serve as the coordinator of our Healthcare Workers Council that serves more than 50,000 members across the United States and Canada. I'm so pleased to be your moderator for this important discussion and to have an opportunity to hear directly from members that are fighting every day to protect themselves and others from this deadly virus. Before we get started, I'd like to remind everyone that we will be recording, as Fiona just mentioned, and sharing this discussion for those that were unable to join us today. You have an option to submit questions to the panelists in the Q&A box, and the chat function is also live for the duration of this discussion. And while I have the floor, I'd like to remind folks that you can find additional COVID-related resources on the USW COVID webpage, which is www.usw.org/COVID19. And this includes important information that may help you to navigate changes that are happening in your workplace. You can also get relevant healthcare sector updates by subscribing to the StatFacts newsletter. To sign up, you just text the letters HCWC to 47486. So that's HCWC, like Healthcare Workers Council, to 47486. So we have 1 hour with this panel of subject matter experts to discuss questions that you may have about the COVID vaccine. This disease is changing rapidly, but so is our federal government's response. Yesterday, CDC Director Rochelle Walensky announced that if you have been fully vaccinated, that you may gather privately indoors with other fully vaccinated people without a mask. That's a revolution, and announcements like that are going to make discussions like this even more important as we inch closer and closer to sort of returning to our new version of normalcy. If you are fully vaccinated, you may gather privately indoors with unvaccinated people from one other household, unless any of those people or anyone that they live with has an increased risk for severe illness from COVID. Furthermore, if you've been fully vaccinated and then you're exposed to someone with COVID, you may not need to quarantine unless you're symptomatic. So needless to say, things are changing quickly and they're complicated, but there is real reason to feel hopeful. It is true we have experienced devastating losses and hardship. The US has documented more than 29 million COVID cases, resulting in more than 525,000 COVID deaths in the last year. But it is also true that there are now more than 2 million COVID vaccine shots administered every day in the United States. We're very close to 3 million every day. More than 90 million shots have been administered to Americans in the short time since the Pfizer vaccine first achieved their emergency use authorization, which was later followed by Moderna and Johnson & Johnson. So really we're at a critical point right now where the union is really jumping into this conversation. The vaccine is now available to qualifying groups of people based on their employment, age, and health. And many of you are going to be offered an opportunity to take the vaccine soon, if you haven't already. Some of you may even be compelled by your employer to take the vaccine. And that's going to raise a lot of serious questions that require our attention. So to be absolutely clear, the United Steelworkers believes that vaccinations should occur in a just, fair, and equitable manner that ensures that communities that experience the most risk of severe disease and death are prioritized for access to vaccinations. The USW also supports CDC recommendations for healthcare workers to receive the COVID-19 vaccinations to protect themselves and vulnerable members of their community, and that as it becomes available, it should be free of charge for everyone with no out-of-pocket costs. However, the USW does not support mandatory immunization as either a condition of employment or as a state or federal mandate. As with other vaccines, the USW believes that the COVID-19 vaccination should be voluntary. And the union intends to continue fighting for vaccination policies that include informed consent and education regarding vaccination benefits and risks. The whole world has changed in the last year. exposing the truth of our healthcare system vulnerabilities, under-resourced infrastructure, under-regulated institutions, and systemic racism. As labor leaders, it also exposed another undeniable truth: the union difference. Our union represents many intersections across multiple communities, and we have a wonderful panel assembled for you today that share a depth of knowledge and insight into the experiences of a wide range of workers. So let's take a moment today to step back, assess this situation, prepare ourselves for this fight, and continue this fight together. I hope that I've helped to set the tone for this discussion, and let's get started by meeting our panelists. Dr. Stephen Markowitz is an occupational medicine physician and epidemiologist that directs the Barry Commoner Center for Health and the Environment at Queens College, City University of New York. He was educated at Yale and Columbia Universities and completed residencies in internal medicine at Montefiore Hospital and in occupational medicine at Mount Sinai School of Medicine. For over 2 decades, Dr. Markowitz has directed the Worker Health Protection Program, a national medical screening program for former Department of Energy nuclear weapons workers at 14 DOE sites in 8 states. Welcome, Dr. Markowitz. Mike Wright is the director of the USW's Health Safety and Environment Department. He joined the union as an industrial hygienist in 1977 and became the department head in 1984. He has degrees in engineering from Cornell and environmental health sciences from Harvard. Prior to joining the USW, he worked as a political organizer around occupational safety and health issues in Massachusetts and was a founding member of the Massachusetts Coalition for Occupational Safety and Health, MASCOSH. Welcome, Mike. And Amanda Fisher is an assistant general counsel in the USW's legal department. She primarily works with staff and locals from District 2, but is also assigned to projects or cases impacting members across the union. Finally, I'm Tamara Lefkowitz, and I will be helping to facilitate this discussion for the next hour. With that being said, I'm excited to have an opportunity to learn more from our esteemed panelists today and a special guest to discuss her experience with the flu shot fight. Please submit any questions that you may have in the Q&A so that we may address them. And we're going to kick off this conversation by really handing over the mic to Dr. Markowitz. He has a brief presentation to share with us. And Dr. Markowitz, can you help us understand how it's possible for this vaccine to develop so quickly and why people should trust it?
Yeah, sure. Thanks, Tamara, and everybody for having me back. Okay. You know, this is the big picture. And my job today in part is to try to address, what's going to be increasingly the issue, which is the people who don't want to get the vaccine or reluctant, ambivalent, or what have you. And the big picture is that the vaccine is safe and COVID is not. And it's overwhelming and it's stark. There's a stark contrast. And we'll get back to that. These are the questions I think that were promised in the agenda that I would address, which is, can we trust the vaccine? Will it make me sick? Are there medical issues that I need to know about that I might not get the vaccine? And what about the new strains? So I want to just remind us where we are in terms of this pandemic. We've had enormous improvement since mid-January, right? This enormously steep decline. But here we are, there's a relative plateau in the last couple of weeks. It's kind of evened out. The decline may be drifting downwards, but it looks like it's reached a new level. And I would point out that this, even though this is hugely better than it was just, say, 6 weeks ago, if you look at the level we're at now, it's the same as the level we were at during the terrible surge during the summer. So even though it's gone down a lot, we still have a lot of disease, a lot of cases occurring all the time. And where do we think we're going? Well, this is where we are now. You can see this was the decline in the last 2 months. And then the question is, we're not sure where we're going. if vaccination goes smoothly, if people continue to take the protective measures, then we should get a lot more decrease over the next couple of months. But if bad things happen, then we could easily come with not a huge surge, but certainly a continued number of a lot of cases. So we're going to stay tuned on this issue and continue to do what we've been doing. You know, I listed the reasons why people might not get the vaccine. Actually, I made this list. I'm not going to run down this list because I want to talk around some of these things. But if you just take a quick look while I'm talking here, you may see some of the things either you feel yourself or you've encountered. And actually, this list isn't even entirely complete, but it fills most of the slides. So let me address some of these things here. I want to give you some context. The current flu vaccines are 50 to 60% effective. That's the best we can do with the flu vaccines for a number of reasons. And so when they started out testing the COVID vaccine, they said, this is our target. We want a vaccine which is at least 50 to 60% effective. And if we get there, then we've done okay. We've done pretty well. Okay, so that's the floor, and that was the target when we started out developing the COVID vaccines. So one issue is some people think that the vaccines aren't safe. In particular, you know, haven't been around that long. We don't know what the side effects are down the road. That's true in part. We've had the Moderna and the Pfizer, the trials began last summer. So we've had all of 7 months follow-up on the use of those vaccines. And so far, so good. They haven't reported any major problems. I'll go over the minor problems, but they haven't reported any major problems over the last 7 months. So I think that's very hopeful. Secondly, the vaccine itself is destroyed by the body as part of the immune response. So it's not as if the vaccine lingers at all, meaning that we wouldn't really expect long-term effects. And then finally, of all the other vaccines in the past, we haven't really seen any long-term effects from vaccines. So it's not as if the overall context or history suggests that we should have a problem long-term. The mRNA vaccines, the ones we use mostly to date, just to give you some specifics, they do not contain the live virus. A person cannot get COVID-19 from the vaccine because the virus is not injected into the body. That's true for Johnson & Johnson as well. And in fact, that the genetic material that's injected as part of the Pfizer Moderna vaccine, it doesn't get into our DNA. And as I mentioned before, the cells get rid of that genetic material very quickly. So shouldn't stick around and shouldn't be a problem. Now, these are the effects that you yourselves probably have had if you've been vaccinated, or you certainly heard about. This is the Moderna. These are actually data from the Moderna study. Pfizer is virtually identical. Everybody has some pain in the arm at the first dose and at the second dose. The first dose, only about a third of people get some headache or fatigue. So some people get it. But at the second dose, it's much more common. Up to 2/3 of people develop headache, fatigue, muscle aches, and the like. More common in women than in men. The good news is it only lasts a day or two. Some people get fever, but it's pretty uncommon. Only lasts a day or two and passes, and then the person is fine. It just means you have to be prepared for it sort of mentally and in terms of your work schedule. Short-term serious reactions to the COVID, only anaphylaxis, which is where the airways close up. It's an emergency, but all vaccination locations are equipped to deal with it, and it's rare. It only happens a few times per every 1 million people who've been vaccinated. And as I said before, no long-term effects have been identified. And in terms of who shouldn't get the vaccine, any of the vaccines at this point, there are no medical contraindications. There are no diseases that a person might have which would prevent you from getting the vaccine. If you've had a history of this anaphylaxis, this airway closure in the past to a vaccine or any of the vaccine ingredients, then you shouldn't get the vaccine. And as far as we know, although it hasn't been thoroughly tested, no issues yet have arisen in pregnancy or while breastfeeding in terms of getting the vaccines. Not specifically studied. It is under study now, but I don't know when we're going to actually get real results from that. Some people think this is very popular source of hesitancy, that the vaccines were developed too quickly, and that therefore there must be something defective about the process. And not sure exactly how to counter that, except to say that at the beginning, the federal government threw billions of dollars at the companies and at NIH to develop these vaccines, regardless of whether they succeeded or not. So here you had private companies who were going to receive billions, even if they completely failed. So that's an entirely different kind of context in which to develop any sort of medicine. Secondly, although we've never had an mRNA vaccine that's been in widespread use, the scientific methods used to develop that vaccine and the J&J vaccine have been around. They've been around for years, and they are proven methods and technologies. The other thing the government did when they threw billions at the companies is they helped develop production capacity at the same time as the scientific development of the vaccines. So you had things occurred in parallel, meaning that as soon as the studies showed that the vaccines were effective, that meant that the companies were able to put out relatively large quantities of vaccines as soon as the results were available and approved by the FDA. And then finally, you had this enormous collaboration, which we rarely have to develop these vaccines. So the time frame of a year was fast, but there's some good reasons for that. So why should we trust the COVID vaccines? One is they've been tested very well in uncompromised trials. One interesting part of the Pfizer and the Moderna vaccine is the trials had identical results. And when you have by entirely separate independent groups, scientific and company groups, when you have identical results or very similar results across studies, it really gives you a lot of confidence that the studies were done well and that then the results are real. And then finally, if we had this kind of talk, I would say in December, and you said, why trust the COVID vaccine when it was absolutely brand new and just coming out, I think there'd be one answer to that. But now, 3 months later, we've had real world use of these vaccines. In fact, 60 million doses in the US, and still no real problems identified with the vaccine. So a lot of experience now. This is where the Moderna, some people say, well, the vaccine doesn't work. It simply isn't true. And I just give you some numbers from the Moderna trial just to demonstrate. 94% efficacy, I think you already know that. 185 people in the placebo group out of the 15,000 developed COVID versus 11 in the vaccine group. So it's enormous difference in the risk of developing COVID as a result of getting vaccinated. Some people say, well, you can't trust the government. I don't know if anybody on this call or meeting has that opinion, but there are people out there who believe that. The fact is, it wasn't the government acting alone here. All these vaccines are public-private partnerships. Pfizer, Moderna, Johnson & Johnson, obviously they're private companies. Now, some people may not trust companies or the government or trust any organization, and I'm not sure what to say to that, but this task was of developing and disseminating vaccines is far too big for the government to handle alone. And it's impossible, frankly, for the private sector to handle alone. So it had to be a partnership. Now, these are some of the other reasons people say they don't want to get the vaccine. And by the way, the reason why I'm really emphasizing this is because the supply issue is being solved. Within a few weeks, there will not be a problem with the supply. And then we're going to unmask the real problem with vaccination, which is that a lot of people won't take it. And that's I think, what we really need to emphasize now. So these are some of the other reasons. I know I've used all my time, so let me just quickly say that, acknowledge that there are stark and current reasons for mistreatment of populations, including African Americans and to some extent Latinx people who don't want to take the vaccine because they don't trust. Understood. That's a real issue and an issue that needs attention. It's gotten some play, but I don't think it's gotten the attention that it really needs. There's the issue for immigrants, perhaps those who are undocumented, that they don't want to give up personal information that's needed in the vaccine system. That's an issue to deal with. Some people can't get an appointment, but I think that's going to be resolved. And then some people think that they're just invulnerable to COVID. But the last issue I really want to talk for a minute about is the variants. And so the Johnson & Johnson just came out in the last couple of weeks, has the advantage being a single dose. You can put it in the regular refrigerator, so it can be used in a lot of different settings where you can't use the others. But here's the key result from Johnson & Johnson. Only a 67% overall efficacy. So that's lower than Moderna or Pfizer, right? But notice it's higher than the flu, 50 to 60% that I mentioned before. So it's pretty good efficacy. But against the variant that we're really concerned about for the vaccine, which is the 1351 variant, it was 57% effective. Again, that's in the threshold of where the flu vaccine is. So Johnson & Johnson has pretty good efficacy against the one variant right now that we're concerned about might be immune to the vaccinations. And as far as the Moderna and Pfizer, which most people have gotten vaccinated in the US have gotten these, there's some reduction in antibody activity against this particular variant, but that's a kind of a laboratory study, and we don't really know what it means in practice. So the key thing, though, is for people to get vaccinated, because if the virus doesn't have a chance to spread, it won't mutate. And if it won't mutate, then it won't form bad variants. It's kind of as simple as that. So finally, for the people who say, I won't get COVID or COVID is a hoax, then I just return to the scorecard as a response to that, because, you know, it's a problem. Thank you.
Thank you for that answer, Dr. Markowitz. I think the most compelling slide that you showed was scorecard showing 525,000 deaths from COVID and none from folks who have received a vaccine. You can't argue with those numbers. So moving on to sort of the impact of this vaccine in our workplace and how employers treat us as this virus sort of is wrangled across the country, and we start to bring this pandemic to a close and a new sense of normal. Employers, I think, may feel sort of emboldened by the vaccine and sort of absolved from any responsibility in continuing the mitigation efforts that they currently use to stop the spread, like wearing masks, socially distancing when possible, et cetera. And this is really sort of Mike Wright's world in health and safety. And so, Mike, can you share, what protections will our workplaces need to keep in place, even if we're vaccinated or as these vaccinations roll out?
Some weeks ago, I got a call about an employer who had a relatively small workplace, about 50 USW members. And he had been telling people, we're going to get everybody vaccinated. It's mandatory. We're going to do it all in one day. And the next day we'll be fine. We won't have to do any of these precautions that we've been doing. Isn't that great? Well, unfortunately, it isn't true. The precautions are still necessary, at least some of them. There is light at the end of the tunnel. The vaccines are going to get us back to a state of normalcy, but we're still in the tunnel, even though that light is getting brighter and we're getting closer and closer to the exit of the tunnel. We're still there. The reason for that is, number one, we don't know how long immunity lasts. That's one thing that couldn't be tested on a short time frame, because obviously there wasn't enough time to see if the immunity would last for years. It may turn out that people will have to get revaccinated every year like we do for the flu. We don't know that yet. And we don't, so the first thing is we need to be safe and not sorry. We need to assume that even though immunity will last for a while, we don't know how long. Number two, as Steve said, there are variants, especially the variant, I think it's called 351, that came from Brazil. And there may be other variants as well that spring up over time. Now, the more people who get vaccinated, the less chance there is for a variant to take off. But so eventually that problem will be solved. But for the time being, we need to worry about that. It's an easily solved problem, because the increasing vaccination will let us get past it. So will the fact that the vaccine manufacturers are currently developing a kind of a booster shot to be ready for some of the variants in case those variants can evade the current vaccines. So that problem will eventually solve itself. And third, we don't yet know if people who have been vaccinated and are safe from disease can nonetheless spread the virus. There's pretty good scientific evidence that they can't, or that the spread can be greatly reduced. But we don't know that for sure yet because the studies haven't been completed. So for all those reasons, we need to keep taking precautions. The precautions can be fewer. Excuse me. You, Tamara, talked about the current CDC guidance, which came out a couple of days ago, which talked about the kind of things that fully vaccinated people can do. And let me say, fully vaccinated means you've had your second dose in the case of the two, excuse me, the two first vaccines, and your one dose in the case of the Johnson & Johnson vaccine. And you've waited 2 weeks because it takes about that long for immunity to build up. So that's what fully vaccinated means. So there are a lot of things that fully vaccinated people can safely do. But we still need workplace protections, in particular for people who are healthcare workers, potentially exposed to COVID-19 through patient care. They need the best possible personal protective equipment. And that means N95 respirators or respirators that are just as good. The good news is there is a perfectly adequate supply now of N95 respirators. There are warehouses full of them that the people who have produced them have not been able to sell because we've got healthcare institutions which are, still reusing old ones, still trying to disinfect old ones. But, there are plenty of N95s available. There are also what are called elastomeric respirators available. They're the ones that have a kind of a rubberized face piece that you don't throw away after every use. Originally, those were frowned upon by FDA and CDC because they had exhalation valves, and the fear was that somebody wearing one who had COVID-19 could exhale it into the workplace air. But there are new ones now without exhalation valves, and those are also available. And so nobody should lack PPE at this point. For people who don't need that level of protection, obviously a cloth mask or a double cloth mask, as CDC now recommends, can be very effective. So the first thing we need to do is to keep PPE and keep masking. The second thing we need to do is to maintain social distancing. Everybody knows what that is by this point. The third thing, which is very important, is in indoor workspaces, we need the best ventilation possible. There are guidelines published by what's called ASHRI, which is the trade association for ventilation manufacturers, about how to look at the ventilation system in your building, how to make sure that it's operable. But as summer comes along, simply opening windows can be an effective control. And then we also need things like disinfection, hand washing, symptom checking. Those aren't as effective as we thought they were originally. For example, symptom checking isn't because we know there are a lot of asymptomatic cases, but they're still useful. So all those things are things that we need to keep doing in the workplace. The good news is we're about to see what we've longed for and worked for and filed court cases for in the past administration. This administration is going to give us an OSHA standard. It's actually going to give us, we think, 2 OSHA standards, one for healthcare workers, one for everybody else. And that standard will require a lot of the things that I've talked about. We don't know what's in it yet, but if it's on schedule, it will be released early this coming week. We hope that it will at least be released by the end of this coming week. And it will be effective fairly quickly because it's what's called an emergency temporary standard. So stay tuned. That's coming out, And that's coming to your
Thanks for,
workplace.
yeah, thanks for wrapping that up on a high note, Mike. We're certainly looking forward to seeing what steps the administration is going to be taking to protect our members going forward. And since we're talking about the member experience in the workplace, I'm going to kick this next question to Amanda Fisher from our legal department. And Amanda, the question on everybody's mind who's tuned in today: can my employer force me to take this vaccine as a condition of my employment?
So I think the answer to that, as the answer to many legal questions, is maybe. So first of all, I want to just mention that the vaccines are approved right now under the emergency use authorization. And so there's a question out there about whether or not an employer can mandate under that emergency authorization. And actually just recently, this week, the first federal lawsuit was filed against a county in New Mexico for mandating the vaccine for correctional officers and other county employees. And so, I mean, that lawsuit is really in its infancy right now, but that will give a little bit more guidance as to, where the law is going to go on the emergency use authorization question. But as of right now, what we've been looking at is guidance that's come out from the EEOC. And the EEOC has signaled that employers can mandate COVID vaccinations, although the EEOC also is signaling that it may be preferable for the vaccine to be made voluntary, which is consistent with, as Tamara pointed out, the USW's policy. So if an employer does mandate the vaccination in a workplace, they do have to consider any employees who request accommodation either for a disability or for a religious objection. Now, as Dr. Markowitz pointed out, there currently are not any known disabilities other than an anaphylactic reaction where healthcare specialists are advising that you should not be taking the vaccine. So we don't have any indication that somebody who may have cancer or another type of disability, it's not being, there's no recommendation that they not have the vaccine. So I'm not sure how that is going to play out if somebody requests an accommodation for a disability under the ADA. The other thing is a religious belief, and that is something that an employer needs to be prepared to accommodate. And so if an employer is going to mandate the vaccine, they need to have a plan in place for offering accommodations, at least for individuals who request a religious accommodation. The other thing to think about is there are some screening questions that come along with a vaccination. And if the employer is administering the vaccination and has to go through those screening questions, those questions can raise concerns about medical inquiries. And so that's something that employers have to be a little bit cautious about as well. But again, I mean, the EEOC is signaling that the vaccine can be mandated by employers. Mike mentioned that OSHA is finally getting in the game here. And the administration directed OSHA, the Biden administration directed OSHA, as Mike said, to take some action. And so on January 29th, OSHA put out the first kind of comprehensive guidance for employees relating to COVID. And in that guidance, it mentions vaccination and it recommends that the vaccination be made available to all employees at no cost, and that employers can provide information and training on the benefits and safety of vaccinations for employees. And so again, OSHA doesn't address the mandatory question, but is signaling that, that employers should be educating employees about the benefits of vaccination. And the other thing in the OSHA guidance is that employers should not be distinguishing between workers who are and who are not vaccinated. So, the suggestion is not that a worker who's been vaccinated doesn't have to wear a mask, while a worker who's not been vaccinated does have to wear a mask. And that, I think, is going to become potentially an important issue as we have, some workers who are vaccinated and some workers who are not. Then the other legal question here is, from the National Labor Relations Board standpoint, can an employer unilaterally implement a COVID vaccine policy without bargaining with the union? And the response to that, again, is maybe. It depends on, there are a lot of legal questions always around an employer implementing a policy mid-contract. And, recent changes in NLRB law unfortunately makes it a little bit easier for an employer to implement policies without bargaining with the union. And so we'll have to review, in each and every circumstance, if a policy is, if an employer is putting a policy out there, even a voluntary policy. I mean, we want to take a look at that policy. We want to request a copy of it always from the employer. And our advice is, and we've shared this with staff representatives, our advice is that we should make a demand to bargain for a voluntary policy, for a mandatory policy, and we'll deal with the legal implications of whether or not we have the right to bargain, but we should request the policy, we want to review it, and we want to make a demand to bargain. And there are some things that the union can bargain, even in a voluntary policy, that I think could be extremely helpful. For example, as Mike said, we want to make sure that employers are maintaining safety protocols, even if employees are being vaccinated. We want to make sure that the safety protocols are still in place. Mask wearing. We don't want those thrown out the window. We want to make sure that if the policy is mandatory, that there's a procedure in place that everybody's aware of about how to request an accommodation. We can request a bargain over education for our members that the employer can assist with in terms of, helping our members understand that the vaccines are safe, and, helping to get their questions answered about whether or not they can or should be vaccinated. Discipline, we can bargain over discipline if the employer tries to implement a policy saying that somebody will be disciplined if they refuse to get the vaccine. The staggering of vaccinations. I mean, I heard an example of, this was actually in a hospital, and an entire floor of doctors were vaccinated. They came in and said, okay, we're going to do the whole 4th floor today. Well, then the next day, half of the doctors called off because they were not feeling well. And so ensuring that an employer is thinking through the staggering of the vaccinations, and the potential for absences if somebody does need to take time off the following day. We want to make sure that we have a plan in place for that as well. So there's a ton of questions that we want to ask and that we want to talk about in the event that any kind of vaccine policy is put out there by the employer. And I think the other thing that the union can be really helpful in, and just on the bargaining issue, is making information requests. I mean, that's always a recommendation when we're going to bargain over something, but we haven't seen too many employers putting out a mandatory or suggesting a mandatory policy. But the few I've seen, they raise more questions than answers. And so, the union can be really helpful in thinking through those questions and trying to get our members, answers that they might need.
And I think to that point, employers who think that a mandatory policy is sort of the best bet for them to go to might be surprised at how much more difficult. It's a lot of work to mandate this. Because it's subject to collective bargaining, it's subject to ADA limitations. And I mean, no matter what, it's subject to bargaining with us. but bargaining with us over a process that we volunteer for is a lot different than bargaining with us over a process that you're trying to mandate on our members that people may have legitimate concerns about. So, so with all of this being said, I wanted to thank you for that, Amanda. Your answer was extremely thorough. And again, there's 100 more questions that we could ask sort of under this umbrella, right? But in the interest of time, I want to sort of pass the mic to a special guest that we have with us, Kathy Drummond, the assistant to the director in District 11, experienced this issue in a similar but different way at Essentia with the mandation of the flu shot. The reason I want to bring the flu shot issue to everyone's attention is that, you know, this ain't our first rodeo, right? We have negotiated vaccine implementation for other vaccines in the past. You probably already have a template to follow in your contract already, or in other, you know, letter of agreement or labor management discussions related to how the flu shot is administered every year. And we feel that this sort of falls along the same lines, and that Kathy's experience will be relevant to all of you. So please, Kathy, share your experience about the flu shot.
Thank you. And just a little bit about myself. I'm the assistant to the director in District 11, and Local 9460 is the local that was being impacted. It is an amalgamated healthcare local with 16 different contracts. The members work in both Minnesota and Wisconsin, and there's about 2,400 members. At Essentia, we have 11 contracts with that employer, and about 2,000 of the 2,400 members are working at Essentia. At the time that we had this arbitration in 2018, and we had about 70 of our members work from home and about 300 that had no patient contact. So a little bit of history, I guess before I go into a little bit of history about how we got to arbitration is when they went from a informal voluntary policy for the flu vaccine to a mandatory policy, it wasn't the argument over being pro or anti of this vaccination. It was the employees were very concerned that now this was going to be a condition of employment, and was this a reasonable rule? So as I said, this for years, we had an informal voluntary influenza vaccination policy. And in August of 2015, where the employer had a rate of 70%, they had modified the policy to say that a condition of employment was that the employees had to reach one of three options. One, get the vaccination. Two, obtain a medical waiver from the employer. Or three, it was a declination process where they had to review an online educational program regarding the flu vaccine, and then they had to complete a related online form. The union did not file a grievance, nor did we enter into bargaining back in 2015, as the employees still had the option to decline the vaccine, and there was no jeopardy for losing their job at that time. So going to 2016, with those changes made in 15, our rates went from 70% to 82%. But the employer wanted to reach a goal of 100%. And so in 2017, they started making changes to work towards that goal. And part of that was under the CDC's Healthy People 2020 initiative, where they were really urging medical facilities to reach a vaccination rate of 90% by 2020. So at that point, the employer implemented the mandatory vaccine policy, where they removed the declination process and they implemented a religious waiver. So the employees now were going to be required to take the vaccine unless they could get an exemption through a religious or a medical waiver through the employer. The union was informally notified that fall. We went to our first meeting with the employer the end of September, where we were then given the timeline that the vaccines would begin October 2nd. There would be deadlines that would be reached, but November 20th would be the actual termination date for the employees if they hadn't reached an exemption through the medical or the religious, or they had not had the vaccine itself. Those timelines ended up being deferred out to about December, but in fact, we did have some of our members that were terminated by not taking the vaccine. In those meetings, we offered other alternatives such as wearing surgical masks and gloves, sequestration, furloughs, which none of the employer wasn't interested in making any modifications to their policy. So on September 29th, the day after our meeting, we filed a class action grievance. At the same time, we filed a charge, the unfair labor practice charge, the National Labor Relations Board. And on October 20th, we filed a federal action in the U.S. District Court in Minnesota asking for an injunction. The board deferred on this case to our arbitration process in the collective bargaining agreement, and the court denied it based on the grounds that we could get the same remedy if we had if we take this to arbitration. So through the process of our grievance, we were able to appeal it to expedited arbitration, and we had a 2-day arbitration in March of 2018. When we went to our arbitration, we were very lucky that we were able to get Dr. Michael Osterholm as our expert witness. Dr. Osterholm is the director of the Center for Infectious Disease Research and Policy at the University of Minnesota. And you probably have heard in the news that he was named a member of President Biden's COVID-19 advisory board. And he was able to, I just want to highlight a few of the points that he made during the arbitration after his many years of studying on vaccinations. He has said on his analysis, reliable scientific data shows that the flu vaccine is not particularly effective, and as a result, vaccinated employees present more risk of transmitting flu to patients than unvaccinated employees do. The risk is because for 2017 was his example, 60% of vaccinated employees were not protected due to vaccine failure and did not take the extra precautions like wearing the surgical masks. The effective rate varies year to year. However, it's been as low as 10 and often is less than 40%. He said that it is not, like other infectious diseases such as measles and mumps, the communal or herd immunity that protects even the unvaccinated could never be achieved with the flu, even if 100% of the employees were vaccinated. And the employer's witness, expert witness, didn't dispute this. He actually agreed with it. And he said that if the employer really wanted to make this mandated and was looking at patient safety, then all of the employees should have worn an N95 respirator during the 2017 flu vaccine because 60% of the employees who were vaccinated had vaccination failure. The decision by the arbitrator ruled in favor of the employer. The ruling stated that while Dr. Osterholm made a powerful case that as a matter of public policy, termination of employment is disproportionate when weighed against the uncertainty of the data. But the arbitrator's authority was not to render a judgment on public policy. And so the record states that the employer's approach to implementing the mandatory flu vaccine was a gradual one. Before enforcing a mandatory policy, it exhausted voluntary approaches. They found that the process undertaken to reach the mandatory rule was reasonable. Our claims of desperate application of the rule, the CBA provides a grievance process to any employees who feel that they were not treated equally. And for inclusiveness, the employer's choice of broad inclusiveness is consistent with its mission to protect the health of its patients and staff. So weighing all of the evidence, including the employer's belief in an overabundance of caution regarding the flu transmission, it was concluded that although other options could have been chosen, the rule chosen was reasonable within the meaning of the management rights clause of this collective bargaining agreement. And
Kathy, I just want to say, I think it's so important to share your story because in particular, I mean, it's relevant because it's very recent that it's relatively recent that it happened. I think we're going to experience a lot of the same things with the COVID vaccine as we did with the implementation of flus as well. And often our solution when fighting about flu shot mandation is to have people wear a mask as an alternative, right? And that's the current practice in place right now. So there's really a lot of parallels between the experience you shared and I think what we all may be in store for.
Yes.
Thank you. Thank you for sharing that.
Thank you.
We did have a question come into the Q&A, and I'm just going to put this out there to anybody qualified to answer it. The paperwork I received with my first COVID shot states that the shot has not been approved by the FDA because we're under an emergency use authorization. But the FDA is responsible for ensuring the safety of drugs. So what does this mean as it relates to the COVID shot? Dr. Markowitz or Mike, I'm not sure do you want to take this question and explain what the difference is between an emergency use authorization and an FDA approval?
The normal process is full approval, and this emergency use is only utilized under exceptional circumstances in which there's a dire need in which the evidence is very favorable to the effectiveness of the drug. And there may be one or other there hasn't been all that much experience with the drug, so not as much experience as they normally want to see for full licensure. So that's why those set of conditions allow them to approve under emergency use, and then when there's more experience, it'll undergo official licensure. So it's really a short-term solution in an emergency situation. But they do need to see effectiveness before they'll approve it. And if you followed all the processes whereby the 3 currently approved vaccines have been approved, the study results, the briefing documents that are prepared for FDA are very thorough and detailed. The FDA has an independent committee that reviews it and advises, and then the FDA makes a decision. So it's not full licensure, but it has gone through a very careful process, sufficiently to, I think, accept the fact that an EUA exists for these vaccines. I think that answers the question.
Yeah, I think it does. And actually it spawned another question for me, because I imagine that once we achieve FDA approval, as a society, once our vaccines go through the FDA approval process, employers will very likely begin their mandation process sort of on the heels of that. When do you know, like, can you anticipate like how long that might be until we have FDA approval?
Yeah, I don't know. I really don't know. I mean, there's another vaccine or two that are going to come up for approval, I think, in the next 2-3 months. But they can obviously walk and chew gum at the same time, or at least we hope so. But I don't know how much real world experience they need once they've allowed a vaccine under EUA. I don't know how many months of real world experience they want to see. So the short answer is I'm not sure, Tamara.
Okay, well, that's fair. There's a lot of we're not sures in this conversation. I think that's just, again, our new normal.
Can I add one thing to that quickly?
Absolutely, Mike.
Okay, this question didn't come up here, but I've heard it from a number of people who have actually read the FDA emergency use authorization. And what it says is that that the vaccine has to be voluntary, and there has to be informed consent. And people have taken that to mean that their employer can't force them to take it. The problem is that what the FDA means by voluntary and informed consent is that the doctor can't hold you down against your will and jab the needle into your arm. You have to consent to take the vaccine, or else the healthcare provider cannot administer it. That does not change any of the legal status of the employer-employee relationship and the things that Amanda talked about, unfortunately. It only means that you can't be forced by a healthcare provider or by the government to take the vaccine.
So we can't be forced, but on the other hand, like, we're thinking about the carrot and the stick, of this relationship. So when we think about the carrot, I think another interesting avenue to explore on this issue is incentive programs, and options that we may be able to bargain some kind of incentive for people to participate in. But something I read just yesterday, and I don't know if Amanda, if you have knowledge of this or not. I know I didn't prep you on this, or we didn't talk about this before the call, but just yesterday, I heard that that new regulations were issued in regards to incentives for wellness programs for health insurance, and that the incentive has to be de minimis to be legal now. So it has to be below a certain dollar threshold. I'm not sure what that is. And I think that these issues are sort of developing, but I don't know, Amanda, do you have any insight on that?
No, I don't. No, I hadn't seen that. I did see just today, as I was sort of, making sure I was up to date on the latest, because it's literally like every day things are changing. So I had to check, what happened today. But I saw a survey out there that and I don't know how, how well the survey was done, but it said that actually only like a small percentage of employers are considering mandating the vaccine, smaller than I had expected, but a larger percentage are considering some sort of incentive program. Now, this article I was reading didn't go into detail about what those incentive programs might look like, but certainly that could be something that we would see. And then that raises a whole another slew of legal questions about, as you're pointing out, whether or not the incentives are okay. So, but I think that that's another thing that we might start seeing.
Yeah, and there's sort of two avenues there. Like the incentive programs, I've seen people just getting straight cash, $300 in order to get your COVID vaccine taken, and it increases compliance. But it also makes people feel like you're paying me money because this is a dangerous thing to do, or it's something I need to be paid for because it is somehow inherently risky, which I think goes against the very idea of encouraging people to get vaccinated. And then there are wellness programs that a lot of employers have our members participate in, and those are heavily regulated. So what kind of incentives would those offer, or are they allowed to offer? And there's just a million questions with this. And I'm glad we had a town hall to discuss it all, but it really feels like we just scratched the surface. So with that being said, I'm going to go ahead and wrap things up because we're getting to 2 o'clock and we're supposed to keep this to 1 hour. So I'd like to thank all of the panelists today for your contributions and all of you that have listened in and for your compelling questions. Actually, before I say goodbye, I should read out the one that's sitting in the chat. Nick Young submitted a question. If someone already had the COVID vaccine, if somebody was already sick with COVID, do they still need to be vaccinated? Dr. Markowitz answered in the chat. The short answer, in case we don't get to talk about it, is yes. Immunity after infection is variable, so a vaccine will make sure that you have your immunity. So those are all of the questions submitted. We've gone through them and answered them. So thank you, everybody, for joining us. It's been a real pleasure to host this discussion. Let's get to work beating this virus and restoring our communities. Thank you again to the Tony Mazzocchi Center for your support and collaboration, Dr. Stephen Markowitz, Mike Wright, Amanda Fisher, and Kathy Drummond for all of your contributions. I am Tamara Lefkowitz and from the Healthcare Workers Council, and this has been the Vaccine Town Hall. Thank you and stay safe out there.